Good evening, everybody. This is Dr. Artis, and I want to talk to you tonight about should you have surgery. I just had a phone consultation about, should I have surgery? The doctors want me to have surgery. I just had a couple consultations today in my office about should you have surgery? And one of the questions I always say is like, have you tried every possible avenue to actually not have surgery first? You want to always go from least invasive to most invasive before you actually go to the most invasive thing. Because I gotta say, is a lot of times I see people in my office that are they've already had surgeries. They've had fusions in the neck, they've had fusions in the low back, and the pain just did not go away. Now, was it worth it for the time and recovery? Was it worth it for their body to actually heal and go through all those different things? I don't think so. And a lot of times too, if I would have gotten to them a little bit before they actually had that surgery, enough time to actually take pressure off those discs, we could have probably helped them to actually not have surgery. But there are times when people do need surgery. So the question that people have to ask is like, have I tried everything? A lot of times people are in so much pain that they lose hope, they lose despair. So they feel like, man, I'm listening to all these doctors saying I should go ahead and have this surgery. And I don't think that's always the case. I just got the phone consult with a family member tonight, and I was just talking about it, and it was like, man, they want me. This orthopedic surgeon is one of the best. They said I should have the surgery. They said I should have this, and then we started went through a whole line of questions, and it was like, did you do traction? Did you find a good CBP doc? Did you find a lot of different things that could help you? And when the answer was no, but they only been doing it about 2 weeks. And one of the things I will say is that you got to give it longer than that. The body takes a lot longer to heal. Everybody's body is at different levels. Now, people that are more likely or higher to have surgeries are going to be our older population when they have a severe amount of degeneration and arthritis. Those are different things that are kind of inevitable, especially when you have disc degeneration, spinal canal stenosis, all these different things can actually cause your body to break down. So, one of the things it is, no doctor can tell you if you should have surgery or not, unless you get in an accident and you're in like a healthcare crisis and you got to have immediate surgery. That's when some people would do it. But I would just always say, put it off last, try all the alternative things. And also, when you try these things, expect for them to work and play at 100%. You can't just play at 50% and expect to get 100% results. So the ball is in your court. It's no one set answer to it. But the one thing that I will tell you is that make sure that you give it enough time, and you got to find a trusted professional, somebody that you trust that actually can help get you through that process. So, should you have surgery? Again, it's up to you. You find a good team, you build a good team of doctors around you that you can trust, and you advise with those doctors, and then you make an educated decision about it. But then you also got to look at the pros and the cons, but don't let it be the first thing that you run to. Because a lot of times it's the first thing that people run to, they see no other way, and then I end up seeing them in my office and they've got vertebrae fused together, and now they're actually putting more pressure on the segments above it and the segments below it, and then that's going to cause more problems. I got an example. I had a 50-year-old patient that high level executive downtown Chicago, could never hardly make her appointments, could never hardly do this because she was traveling, all these different things. End up having back surgery. She's on her third back surgery now because of what happened with the first surgery. And then so still no relief, a little bit of relief, but not as much as what she went through to get to that point. So again, you got to go back, you got to break it down, you got to look at these different things and then make your decision. If you want more information, contact me for a consult, and then we can talk about it, and then going from there. But blessings again. I hope this information helps somebody out there. All right.